Welcome to Devex at the 77th World Health Assembly, a special edition of This Week in Global Development. My name is Rumbi Chakamba. I'm an associate editor at Devex. This year's World Health Assembly is a pivotal moment for global health security, with countries working to finalize a pandemic treaty and amendments to the international health regulations, which are a legal framework for handling cross-border public health emergencies. This has been an ongoing process where some countries are hoping to right the wrongs exposed by the COVID-19 pandemic and ensure that the world is better prepared for the next outbreak. But negotiations have not been smooth, casting uncertainty on whether the process will result in agreements that promote equity and global solidarity. Throughout the week, my colleagues and I will peel back the curtain and take you behind the scenes at WHA as we speak to the people shaping the future of global health. The cases of sexual exploitation and abuse during the 2018 to 2020 Ebola outbreak in the Democratic Republic of Congo have become one of the largest sexual misconduct scandals in the United Nations history. The cases initially involved more than 50 women who accused Ebola aid workers, including World Health Organization personnel, of sex for work schemes. After the media exposed the misconduct and an independent investigation revealed the extent of the abuses, WHO set out to clean house in the hope of regaining public trust. This included appointing longtime staffer Dr. Gaya Gamhewage as Director of Prevention and Response to Sexual Misconduct. In this episode, I sit down with Gamhewage to discuss the progress her department is making, the challenges they're encountering, and the lessons other agencies and NGOs can learn from WHO. Dr. Gaya, thank you so much for joining me for this episode. The last time I spoke to you was at WHA 76, and it was one of the most interesting conversations and one of the most important ones that I had. So I really wanted a chance to speak to you again.
Thank you, Rumbi, and that's very kind of you to say so. It has been a year, and it's really my pleasure to be part of your podcast.
Oh, thank you so much. So the last time we spoke, you talked to me about WHO's new policy on preventing and addressing sexual misconduct. You also said you're thinking of setting up, or actually you're in the process of setting up a survivor-centered approach to dealing with this. You're also dealing with ensuring that personnel and leaders are accountable, and setting up new policies, procedures to increase safeguards. So how far has your department come, and what's the work you've been doing this year?
I would say we've come a long way, but we have such a long way to go. This is a really complex issue, and you know, you started off very rightly talking about the victim survivor-centered approach, and it's not just an approach. We really have to do all of this work, putting victims and survivors at the center of everything, not just assistance, of prevention, of policies, of risk assessments, really listening to them. And for this particular area, we have made some inroads. So I think when I speak to victims and survivors, and particularly those in the Democratic Republic of Congo, what they tell me is more than anything, they want justice. They want to see their perpetrators brought to justice, and they want to make sure that these perpetrators do not harm anybody else. Really, that is the uniform thing I'm hearing. And that's why I'm really pleased to say that with our policy change, and we've introduced 3 new policies, one on preventing and addressing sexual misconduct, one on preventing and addressing other forms of abusive conduct, so we've changed that, and also one on addressing retaliation, because we see lots of people don't want to report because they're afraid of retaliation. But of course, protecting victims and survivors in the community is much harder. It's a little easier, not easy, but a little less complicated when the victims and survivors are our own personnel. So with all of these policy changes, we've been able to, for example, look at just listening to victims and survivors. We've separated investigations, which has been professionalized, but we've separated from victim assistance. So if anybody comes forward and says, I have experienced sexual misconduct by one of your personnel or one of your implementing partners, we immediately initiate victim response and support while investigations may be ongoing. So we really listen to victims. We try to provide support, and we've done best, I suppose, or we've done our best for the 83 victims that were identified in the 10th Ebola outbreak in the Democratic Republic of Congo. And in fact, we supported 115 survivors, while 21 of them were associated with WHO perpetrators. The others were from other agencies. But regardless, we've provided 2 years of holistic support, so medical, psychosocial, income generation, and really importantly, legal support. And I met our colleagues from Kinshasa and Goma last week, and they told me out of these 83, the investigations have been completed into 21 that were associated with WHO, and 9 have been substantiated. And for all 9, we are continuing a third year of support. 2 of them could not be located because there's mass movement, and we're still looking for 2 of these survivors. But out of the other 7, they want income generation, but they don't want to be given basket weaving and tailoring. They want something that is appropriate for today's economy, and 2 of them really want support for children. And one of the best things I think that has happened is we supported a women-led legal aid organization in Goma, and what they've done is they've done massive awareness raising for more than 30,000 community members, but more importantly, they've supported a number of women to take legal action through local courts, including against us. So we really, really tried to be very transparent. And the biggest thing that has happened is that the court has made a judgment in favor of children born of sexual exploitation and abuse, even when paternity is not established, to get birth certificates. And you know, without a birth certificate, a child cannot go to school, they cannot become a citizen of a country. Also, we've hired a victim survivor support officer who should be starting with us soon to help me really work through all the policies and the procedures and make sure this is just not lip service, that we are really going to put the need of survivors for voice, for assistance, and for justice at the center of all of our work. So lots of progress, but this is the one that I feel that has ignited even more hope in me and my colleagues.
Yeah, definitely. That sounds like a lot going on. And I think that's an element that we don't immediately think about, like the children born of sexual misconduct. And it's really good that it's like forward-thinking policy. But you spoke about justice, and I think you said 21 cases were substantiated. And also looking at your dashboard, it's the same. You have quite a lot of open cases, but very few that now have sort of action taken after that. Why is that? Is it how hard is it for people to substantiate these cases?
Well, cases have been substantiated. So we got about 220 allegations last year, and if it's sexual misconduct, we investigate all of them. So we're not like other UN agencies. Our conversion rate from allegation to investigation is like 98%. Oh, okay. And for the rest of the UN, it's in the 60s, low 60s. So we really, no excuse means that whenever an allegation is made, we really take it seriously. Now, when a case is substantiated, and we've set a benchmark of 120 days, and in most of our cases, we are meeting that. And again, we're the only UN agency to publicly declare that and measure ourselves. What happens is when a case is substantiated, that's only the first part. Then the alleged perpetrator has the right to receive all the information and receive a charge letter saying, here is an allegation against you, and because of these facts have been established, we have substantiated the case. Now what do you say? So there is a due process that is followed. It's an administrative process that is followed across all UN agencies that allows all parties to make their side known. So that does take some time. So if somebody is not available, or they're on sick leave, or there are various things. I honestly believe having really being true to that process builds confidence and trust.
Yeah.
Because everybody has a right to defend themselves as well, right? But you have to remember, all through this, victim support is provided. So while it can take some time, and you'll see there are 21 sexual misconduct cases in which we have dismissed personnel, including very senior level. And we're the only UN agency, if you like, to put that kind of data out in the public and update that every month.
Yeah.
I know some UN agencies like UNHCR are beginning to do that on an annual basis. But for us, being transparent about this communication has many benefits. First of all our workforce realize that there is no excuse, that misconduct leads to discipline. Second, I think victims and survivors, even those who haven't made a formal report, begin to trust that something will happen. Of course, people are frustrated when it takes time, but I think if we take all the right steps and take the required time, our decisions are less likely to get overturned on appeal. Because remember, once we've taken our decision for disciplinary action, the alleged perpetrators have the right to go to internal and external appeal, including to the ILO tribunal, administrative tribunal. So what we want is this to be solid, follow the process so it sticks. And we are trying to, we're doing our best to speed up the post-investigation phase as well. But we have to balance things, and we have to be fair to everybody, I believe.
Are you looking for the inside story on what's happening at organisations like the World Bank, USAID or the Gates Foundation? Then you need to be reading Devex Pro. I'm Jessica Abrahams and I'm the editor of Devex Pro. Pro is Devex's premium news subscription, where our expert reporters and analysts take you beyond the headlines, deep into the trends and institutions shaping the $200 billion aid industry. As well as all our news, you'll get access to conversations with global development leaders, resources to help you grow in your career, and a subscriber-only newsletter full of insider news and tidbits. See for yourself by getting a free trial today at devex.com/pro.
But one thing you've previously said is that dealing and tackling with this head on is going to help WHO regain trust. Are you seeing that happening? And what conversations are you having with survivors in terms of trusting the agency?
Well, I think just the number of allegations, before we started this work, say pre-2021, we had 5 to 10 allegations a year. Last year we had 220, right? And I still believe this is the tip of the iceberg. So if I give you some figures, the UN recorded about 750 allegations of sexual exploitation and abuse last year. But in a survey done across the UN in field locations, what happened was that about 6,200 UN workforce said they knew of a case in the last year, but only 5,200 of them did not report it. Right? So it's not just victims and survivors, it's everybody involved, anybody who sees something, hears something, they don't have trust in the system. But in WHO, what we've been able to do is by first admitting that there was a problem. This is the first thing. You have to admit there is a problem. The leadership of the organization, Dr. Tedros, our Director General, he acknowledged that we failed to take measures. So really accepting, not accountability just for the act of sexual misconduct, but the systems that allowed this to happen was a turning point for us. And then being what I call radical transparency. Not only do we have dashboards, I don't know whether your listeners know, every quarter, every few months, the Director General and I have to brief out on this to all of our member states, all 194 governments. At the Health Assembly, this is taken up. There is an annual report. We are very open with our staff, communicating not just successes, but where we are still not meeting our own standards. And that is creating an environment, slowly but surely, of building trust. Building trust is so difficult. Losing it is so easy. And to regain it is even harder. But I truly believe by being honest about what we're doing and what we're not doing still, And I have, every month I have live webinars, 3,000 people attend live. And in the last year and a half, 17,000 live attendees at my webinars. Every other month, open doors where people can just come online, virtual. We get 800 who come and ask the difficult questions, and we answer every single question. If we can't do it online, we do it in writing. And just that open communication, two-way communication, listening to others has created trust. But we have a long way to go. In countries, in communities, the community-based complaint mechanisms don't work for anybody. The victim services in countries are non-existent or really poor. So in that context, what is the incentive for anyone to report, even if they trusted you, right? Good intentions are not enough. It takes a lot of courage and a lot of risk to report something like this. I myself have experienced sexual harassment during my career. I've never complained. I've never made a report because I couldn't see the benefit of it. I couldn't see what would happen. We were all afraid of retaliation. And at best, you would be thought of as being a complainer, not a leader, not strong. So there is really no incentive. So trust is being built, but we can't correlate it directly to reporting because there are so many other things that have to be put in place, not just by WHO, but by the whole of the UN, and increasingly by our governments. If you don't have gender-based violence referral systems at work, even in developed countries, even in high-income countries, why would you complain? So these are the more complex problems we are grappling with now.
Yeah, I was actually going to ask you next, what kind of challenges are you facing? And maybe you can go a little bit more into that. But one thing that strikes me as really interesting, especially when it comes to something like sexual harassment, I think different communities, different countries, different cultures have got a different idea of where the line is crossed. And you have like a whole different whole world in one office. How do you tackle that, and how do we come up with, I don't know if we need like a universal definition of what's right and what's wrong, and how do you tackle like the cultural aspects of that?
I mean, that's a really astute observation. The answer to all of this is simple. It's not complicated. So the first thing we have to do is to simplify this. And I see it this way. I believe we do have a universal standard, and that is the United Nations and WHO. When we come together for collective work like this, we agree to a value system. We agree to universal human rights, right? We agree to a code of conduct. So regardless of how we were socialized or brought up or what we believe, there is an expectation for the 100,000 people who work for the United Nations that we will maintain standards of conduct. And simply put, don't worry about reading pages. Simply put, we are entrusted to save and serve the world. And we cannot be the perpetrators of harm. We cannot. It's not complicated. You do not need to be an expert. As a mother, as a woman, as a human, as a professional, as a leader, for me, it is about simplifying things to that level.
Okay. And I always like to remind our listeners and our audience that this is not a problem that's unique to WHO. You guys were sort of pushed into the forefront of this because of the DRC, but it's not unique to WHO. So what lessons would you share with like other NGOs, other international organizations around the work that you've been doing, and what are sort of like best practices that you would want to share?
Honestly, number one is leadership. Most of WHO staff want to see a better culture and not to harm people. But without the right leadership, it couldn't be done. And Dr. Tedros's leadership, admitting what went wrong, supporting the survivors, and putting money and people to make the change, not just to make speeches. And we are unique in the UN in the amount of money and people we have. I have more than 450 people working part-time on this. I have about 35 full-time people, senior people, not in my team in Geneva. I just have 2 or 3 here, mainly in the regional offices and in our priority countries. And without leadership commitment to having full-time people dedicated to following, it's not just to run a training or, go to a meeting, but full-time, dedicated, immersed and learning and leveraging the rest of the organization, nothing will happen. So that's really important, not just to give lip service, but to have leadership that follows itself with money and people. The second is what I called radical transparency. Communicate with everybody concerned, your workforce, your member states, your donors, the public, the media, survivors, everybody, and tell them what you're doing, tell them where you're making progress, and be honest about what you have not achieved yet, right? And that requires a vision and a strategy, and we're in the middle of a 3-year strategy, and the strategy is really to institutionalize it in the system. The third is to integrate. You will find in the UN system, sexual exploitation and abuse of communities and populations is managed out of one office, sexual harassment is managed by another, and then sexual misconduct is managed separately from other forms of misconduct. But we're talking when for victims, for survivors, for bystanders, for workforce, we are people who integrate all of this into one thing. So we need to stop this fragmentation and bring integration. So when WHO went by integrating sexual harassment with sexual exploitation and abuse, and we called it sexual misconduct, which actually was just a no-brainer, because everybody understands if it's misconduct, it's wrong, and it will be punished. Now I can see other UN agencies following the same trajectory. So this integration allows you to use what little resources we have in a way that makes sense, not to us, but to the people we're trying to serve. Right? So victims and survivors and people at risk don't need to know the legal definition of all sexual exploitation, sexual abuse, they don't need to know that. They just need to know that as aid workers, everything we offer to them, any service, any goods, is free of charge and does not require any payment, including through sex. Right? That's what they need to know. They need to know if something happens, how can they report safely and get services? They need to be confident that there will be justice and support. So those are the things I would ask them to look at, and I have been asking them to look at, because I think we are all new in this area and we have a lot to learn.
Okay, that's a good place to be. Thank you so much for joining me for this episode, Dr. Gaya. I hope that we can continue this conversation and that we'll be talking about the momentum continuing once again next year.
Thank you, Rumbi, for giving this space and for coming back, because I remember how nervous I was this time last year. We made so many assumptions, but you cannot be sure. You have to show, not just tell. And now I see things a little clearer.
No, thank you so much, Dr. Gaya. Thanks for listening to Devex at the 77th World Health Assembly, a special edition of This Week in Global Development. If you enjoyed today's episode, please share it, or you can also leave us a rating or a review. We'd also love to hear from you if you have any feedback or want to get in touch. You can find me on social media at Rumbi Chakamba _ or send an email to podcast@devex.com. Devex at the World Health Assembly is hosted by me, Rumbi Chakamba. Today's episode was produced by Naomi Mihara and edited by Mai Ilagan.